Okay, there. All right, good afternoon, everyone. So the time is 1:01, so we will get started. The Association for Professionals in Infection Control and Epidemiology Great Lakes chapter is pleased to welcome you back for another educational webinar event. Thanks for taking the time to join us today. If you haven't seen the flyer for our 2023 events, please check it out, and I will drop the link to our website in the chat. We've got some very good content lined up for the rest of the year that we are very excited to share with you. So my name is Chow Win, and I'm joined today by my colleagues Kelsey Austrian and Denise Parr. We are the education team for the APIC Great Lakes and have had the pleasure of collaborating with Rebecca Battjes from Diversey to put on today's event. Our session today is titled, How Social Media Makes Me a Better IP. So a few housekeeping rules before we begin. That's the slide. If you can mute your line to minimize background noise, that would be great. And then drop any questions you have during the conversation in the chat, and we will circle back to them at the end of the presentation. Today's presentation will be recorded and slides will be made available. CE is not provided for this webinar. And with that, I am pleased to introduce today's speaker, Rebecca Battjes. So Rebecca is an infection prevention senior clinical advisor for Diversey. Before joining Diversey in May of 2022, Rebecca was the infection prevention and control manager, program manager at Surgeons Joyce Medical Center and Oakland Nursing Center in Southfield, Michigan. Prior to that, she worked in the infection prevention department at a large academic medical and level 1 trauma center in the heart of Detroit for 16 years. Rebecca earned a Bachelor of Arts degree in English and Spanish literature from Wayne State University and a Master's of Public Health from Benedictine University. She achieved board certification in infection control in 2019 and became a fellow of APIC in 2022. She still lives in the Metro Detroit area with her husband, Mike, her 2 small dogs, Mumford and Phoebe, and an outrageous number of houseplants. So with that, Rebecca, welcome today. Thank you for joining us, and we are so excited to have you here. The floor is all yours.
Thank you. Thank you so much. Just checking you guys can see the slides and hear my voice.
Yes, we can.
Okay, that is the biggest hurdle for us to accomplish today beyond actually creating the content. I want to start by saying thank you to the Education Committee. I think many of you are familiar with me and know that I also did Education Committee for several years for APIC Great Lakes. So Kelsey, Chow, and now Denise, thank you, because I want to make sure everybody knows it's a lot of work to facilitate these webinars and even more work to do the in-person conferences. So thank you so much for everything you guys do. We're going to get started with how social media makes me a better IP. And I do want to say that this has been a labor of love. This is something I thought about probably a year and a half ago. And I remember texting Karen Jones, who I think is on. So I said, I have this idea for a presentation. What do you think? And as always, she encouraged me. So hopefully you'll find this meaningful, and you are the first audience to hear this content. So my ask of you is actually to reach out and let me know what I could do better, or if you think there's something that I missed that you feel is really important to share with future audiences. I'm happy to add that in. Disclosure, as Chow mentioned, I am employed by Diversey, and that means they pay my salary to create content like this and to be here today. But the company has had no input into the presentation from a commercial interest. I think it's really important to let you guys know I've had some conversations with some of the APIC Great Lakes members, and they've wanted to know a little bit more about what it's like to work on the other side in industry. And it's important for me to let you know that I'm not a salesperson and that my salary is completely independent of product sales. And as you can see with this subject matter, one of the best things about working for Diversey is that they support infection prevention regardless of subject matter. Also, as Chow mentioned, I have been working in the field of infection prevention and control since 2005. And so I'm not sure if any of my Ascension St. John partners are on the line, but this is me at my desk back in the day in 2005 when I actually had time to play with stuffed animals and take selfies. So today's objectives, let's review what we hope to accomplish today. First, to describe who is using social media and how they're using it. Secondly, to be able to identify key accounts, influencers, educators, and IPs on social media. Third, you should be able to acknowledge, this is really important, acknowledge that social media is an increasingly utilized academic medical resource, whether you're engaging in social media or not. We're going to dig into that quite a bit. And then lastly, attendees should be able to articulate key benefits and pitfalls of using social media professionally. Let's begin with some definitions. I broke these slides up. I used to have all of the definitions together and it was a bit overwhelming. You'll have these slides for your reference, but there's a key concept here I want to point out, and that's an algorithm. When we're talking about glossaries, social media terminology, an algorithm is actually how social media platforms determine what appears on your screen at any given moment. And so I've heard a lot of us, in my life say like, oh, I was thinking about a pair of shoes and they popped up on my Instagram account, or I was just thinking of something and it popped up on my Facebook feed. Well, the reality is that it's not a coincidence. This is actually a scientific algorithm that looks into everything we do and predicts what we would be interested in. And there's even something called geotagging. So, for example, my cousin-in-law came into the house and commented on pet portraits in my dining room. And the next day they were on his Instagram. It's not coincidence, it's actually geotagging and sharing with people with what's on our phones that promotes the content on the algorithm. And so making sure we all understand that. So that's going to come into play when we talk about misinformation on social media. It continues to perpetuate itself based on the number of clicks and what the user does in other social media formats. The next concept I really want to highlight here, and again, you have the rest of them for your review separately, is an impression. And an impression is a measurement of the number of people who have seen a post. So anytime it appears on a screen, that is an impression, regardless of whether or not anybody clicks, comments, or otherwise engages or reposts that content, which is going to be particularly important when we talk about Twitter and LinkedIn specifically. Now, I discussed my disclosures and I wanted to add a disclaimer because we're talking about content that I really don't think many other people are talking about in our field of infection prevention. And a couple of weeks ago, I had the opportunity to go to Bismarck, North Dakota. And I was the only in-person speaker for their first conference since COVID, and everybody else did a virtual. I learned why, because it's kind of hard to get in and out of Bismarck. You cannot get a lift, by the way, at 6 o'clock in the morning in Bismarck, North Dakota, just as a heads up in case you're traveling there. But the education committee gave me the evaluations within 24 hours, which was super helpful. And one of the evaluations really stood out. And it helped me prepare for this content that I'm delivering for you today, and it grounded me. So I don't expect you can read the handwriting here, but the quotes from, I had mentioned in one of my presentations that had nothing to do with social media, that I had recently learned of a really cool antimicrobial stewardship state-by-state dashboard on the CDC website. And I told the audience that I only learned of that website through Twitter, and I hadn't seen it in any emails, in any of the other official kind of traditional communication chains that I have with the CDC. And so in the evaluation, the handwriting here says, I would never encourage social media. And I have an idea who this was in the audience, because there was an older gentleman who was rolling his eyes quite a bit and not really paying attention. So my assumption that it might be this gentleman. And then he goes on to say, CDC website info found on Twitter? Are you kidding? Question mark, exclamation point. Not impressed. So, at first I kind of, it stung a little bit reading this because I was pretty proud of the content that I had delivered. But again, it reminded me and grounded me that the acceptance and utilization of social media varies greatly across different groups, whether it's by age, ethnicity, gender. What I'm asking, if any of you are in the audience that are listening, because it's hard to know who you all are because I can't see you, keep an open mind, because I totally recognize that social media is not everybody's cup of tea whatsoever. But the point of today's discussion is to open your mind a little bit and to let you in on all of the conversations that are actually happening, whether you choose to listen to them or not. So the bright side, of course, if you've ever been involved in public speaking, it's pretty tough because you put yourself out there and you're vulnerable, right, to whatever happens. And people can tell you that you did great, and they can also, tell you that, you're not that effective, as in the prior slide. But I needed to remind myself to go back through all of those evaluations. And part of those presentations mentioned that I had started a YouTube channel, and that the content I was creating was specifically designed for new IPs who really didn't have anybody else. And so I went back through the evaluations from those sessions, and 11 of the 59 specifically hand wrote out, "I can't wait to check out your YouTube channel." So that's 19%. So it demonstrates that more IPs are looking to social media for support and communication than those that are not. And so I think it's really important, even though it's not an official study and it's a small sample size, it definitely gives you the idea on the difference of opinions when we're talking about social media. Our primary focus when we're talking about social media platforms today are the 6 platforms in front of you. If you're not familiar, again, that's totally fine. I'm here to guide you through. Starting in the upper left, we have Facebook, TikTok, YouTube, Twitter, Instagram, and LinkedIn. And of course, I've been practicing so much that I'm probably going to lose my voice right in the middle of this presentation. So we're going to try something. This is the first time virtually that I've done Poll Everywhere. So if you guys would entertain me and pull out either your phones, or you can use an open browser on your computer if you're at your desk. In your web browser, whether it's Chrome or Safari, whatever, you type in right at the top, pollev.com /, then it's my weird name, Rebecca Battjes 772. And what I would like you guys to do is, once you go in there, you should be able to answer this question. I use social media, whatever the platform is, TikTok, Snapchat, whatever. I'm curious to know if you use social media in any way, shape, or form professionally to promote infection prevention. Let's see if I'm in here with you guys. Give it a couple more.
Rebecca, did you share the number for us to join via our phone?
It's not a phone.
Okay.
It's only online. Yeah.
Okay.
Something happened with the settings that I can only do it online right now. Okay, this is really cool. Thank you guys for answering this. This is really just for my knowledge, and I didn't have any expectations on what we would say. Isn't this always fun? I mean, the fun part is it's actually working. So if anybody needs help with doing an online presentation and using Poll Everywhere, hit me up. So I think we'll stop here. This is a really good balance. And what we can see of all of us that are on the call, who uses, again, social media to promote IP. And now, let's see, this always is a little sticky. Oops, we're going to go back to this. So I'm going to reframe the question a little bit. And don't worry, there's only 2 polling questions, so you're not going to have to keep, going back to your phone. I want to know if you use social media to inform and educate yourselves about infection prevention related topics. And I'll share the numbers because I'm not really seeing it in real time of how many of you are responding. I see 69 of you on the call. That's awesome. So thank you for taking time out of your busy days to join me. Okay, we're still inching a little bit. We got about 80% saying they do use social media to educate and inform themselves, and about 20% saying they don't. So I'm not going to re-poll you, but I'm wondering if at the end of this conversation that 20% is going to decrease a little bit. All right, so let's move into some basic stats. Why do we even care about this topic? Well, there's a growing share of United States adults who are using social media and reporting that out. So if you're looking for internet usage and social media statistics, the Pew Research Group is an excellent data source for all of us. And so in 2022, they reported out that 72% of US adults are in fact using social media. What was really interesting is it breaks down the usage by platform. And I really would have thought Twitter would have been higher up because it's only reporting out at 23%. And again, that's probably my bias of using that app and seeing so many professionals on Twitter. But the reality is that the most used platform by US adults is YouTube at 81%, followed by Facebook, which is about 70%. Now, Facebook is really not utilized highly for professional reasons, and thank God, because I think we all know throughout the pandemic, things got a little dicey, especially on Facebook. Interestingly, too, we see LinkedIn, Instagram being the 3rd most used amongst US adults. Pew Research also breaks this down by young adults, and you'll see these change greatly on what young adults are using. Not surprising to any of the parents on the line. What's interesting is that US adults aren't just using social media for entertainment or fun. Increasingly, they're using it as the regular major source for their news. And so what we see here are those numbers, and then the pink dots inside show the percentage of how many people are using that for regular news consumption. And so of those 82% using YouTube, a quarter of them are actually getting, this is again, they're reporting a major source of their information. Again, really concerning when we look at this in the framework of the pandemic with all of the misinformation and disinformation that we saw. To shift gears a little bit and looking at what healthcare users, or how, if at all, healthcare users are using social media. This is an older study. I totally recognize that, which is why I bolded 2011, but I still found it interesting. This was a mail survey with like a mail-in survey. I think the response rate was about 16 to 18%. So not great. So I always want to point out survey bias and survey response rates. But what they did find of their results was that 94% of the medical students were already active on social media, 80% of resident physicians, and much lower were the practicing physicians at 42%. But I included this study because it shows that we know that the medical students 10 years ago and the resident physicians 10 years ago are the practicing physicians of today, and that would impact the number. And it certainly did. This is a 2021 JAMA publication. This is really interesting, and I added this at the last minute, wanting more updated information. So Hamid and team actually found doctors at the US News and World Report top 10. So whether you think that's a valid publication or not, this is how they conducted their survey. And they broke down the use by specialty, dividing that into surgery and internal medicine. So in this study, 70% of the physicians reported using social media. Interestingly, 90% of them had 0 posts per month. And so that means that while a lot of physicians use social media, they're not actually on it actively promoting medicine or healthcare necessarily. Hamid also found that female and younger physicians had higher odds of social media presence. The younger physicians, not much of a surprise there. And that surgeons and older physicians actually had higher social media activity and more followers. The bummer is here that infectious disease doctors were apparently not included in that top 10 survey. So I think they had many other subspecialties, but I specifically looked for ID. Moving to nursing, this is a nice study by Lefebvre in 2020. This is a single center prospective observational study. So keeping in mind, it's just one center, but this was a decent survey that I found to include in this presentation. The response rate was 28%. And 87% of the nurses reported using social media. Again, if you're on social media, this is not a surprise because nursing in particular really has amplified its voice for better or for worse on many social media platforms throughout the pandemic and of course today. Not surprisingly, lower usage rates were associated with increasing age. But again, similar to those med students we saw in the older study, we're seeing rates of use over 90% from anywhere in nurses between the age of 18 and 45. So this is not something that's going away is the take-home point. This is a very ubiquitous platform and we need to recognize that. Let's move into some literature review. I've already mentioned the terms misinformation and disinformation, and I think it's really important for us to distinguish what those terms mean. We know that misinformation and disinformation plagued social media throughout the COVID-19 global pandemic. And I want to, again, distinguish what these terms are. So Desai in Clinical Infectious Diseases last year defines misinformation as misleading or sometimes false statements that run contrary to the epistemic consensus of the scientific community. Disinformation is unique though, because the key word here that I forgot to bold is deliberate. This is the deliberate spread of false information for secondary gain, whether it's financial, political, whatever. And what I didn't include here, there actually is in the literature noted that there's this concept of the dirty dozen, and that all throughout the pandemic, there were actually 12 individual social media accounts that were responsible for the mass majority of disinformation being spread throughout the pandemic. Obviously, mostly anti-vaccine, but many other types of disinformation as well. And so we all know in infection prevention that these consequences included self-medicating, inappropriate medication consumption, maybe with a horse dewormer, maybe swallowing bleach because a global world leader might have mentioned doing that. Global panic buying was certainly an impact of this social media disinformation. So very interesting that we could see the public health ramifications of what was happening on social media. In a JAMA commentary, Kular recommends that we need to meet patients where they're at virtually to pre-bunk medical myths. And I really love this term pre-bunk. If you're familiar with the term debunking, when we debunk something, the rumor mill has already gotten out of control and we're trying really hard to debunk and untangle those untruths. But pre-bunking, I love that Kular mentions this notion of pre-bunking, because that means we're going to be meeting people where they're at on social media. And Duke University has actually developed a program to educate their clinicians on how to address medical misinformation. And so I hope that's the start of a new trend, because we definitely need more people out there. Desai also categorized misinformation and disinformation into three main buckets that I list here on the left. What I really want you to focus on is what I've bolded in the strategies to address misinformation. And I see these as a call to action. So the first method or strategy to combat misinformation, Desai recommends that social media platforms modify these machine learning algorithms. And so that if we modify these algorithms, we would actually amplify posts that were based on good information, reliable information, versus what's happening right now is they're being promoted based on the number of engagements. So we all know, again, you get those two goofballs on a YouTube channel and they give their opinion and everybody likes it. And so the number of clicks and likes and reposts makes it more likely to appear to everybody else. The second primary strategy to combat misinformation, Desai says to have social media platforms just flag and remove misinformation. And I think many of us know that this became very controversial throughout the pandemic, especially in the last couple of years. We definitely saw more warnings on Facebook and Instagram, where if you were sharing information about the COVID-19 vaccine or the pandemic in general, a warning would pop up saying, are you sure you want to share this information? It's from an untrusted source. Lastly, and this is really a call to action for all of us to be very cognizant of what we're sharing on social media, is to consistently disseminate reliable information from trusted institutions and community leaders in near real time. And so this is really getting to the promotion of domain experts and all of us kind of checking each other as content is being shared, which is a tricky, definitely tricky for sure. Schillinger and team published this sphere continuum in the American Journal of Public Health in 2020. So the pandemic had started, they were aware of the pandemic. It's interesting to read publications about social media and pandemics or epidemics right before the pandemic hit. But Schillinger and team, they propose a framework to guide investigations and assessments of social media's impact on public health. Now, this is a complex paper, I'm not gonna lie, it was a little tough for me to get through. But what I appreciated from this is this visual and this framework where we're illustrating the functions of social media across the entire continuum of a pandemic or an epidemic. And so it shows that for better or for worse, again, whether you're using it or not, there is a role that social media is playing in public health and disease control. And it's not all bad. There's actually some positives. We can definitely use social media to promote positive public health messaging, absolutely. And so for me, the takeaway here is that for better or for worse, again, social media is playing an integral role in today's public health initiatives. And we can stretch that to infection prevention. So one of the key articles that I read in preparing this presentation was from Dr. Kelly Cawcutt, and she is the Associate Professor, Medical Director of Medical Quality and Infection Control. And this really interesting title, she's Co-Director of Digital Innovation at the University of Nebraska Medical Center. And she wrote an article in 2019 in ICHE, and we're gonna dig into it a bit more. But this quote really resonates with me. No corner of medicine remains free from the social media eye or the need to optimize the quality of care and patient safety by preventing HAIs, outbreaks and adverse events secondary to inappropriate antimicrobial use. Independently, each have the power to change medicine. However, synergistically, the impact could be transformative. I love that. So if we combine all of these concepts together, we really can make waves. So the title of this 2019 publication is Using Social Media to Disseminate Research in Infection Prevention, Hospital Epidemiology, and Antimicrobial Stewardship. And this is written before the pandemic, right? So she probably drafted this in 2018, you know, if it's being published in 2019 or thereabouts. And so really, again, thinking about how naive all of us were, I was especially, I won't speak for all of you, but I was certainly naive to a global pandemic and what was going to unfold from those events. And she asks, though, in 2019, how many lives could have been saved if Dr. Robert Koch, who you know, discovered much about TB and its infectiousness, John Snow, of course, the infamous water pump and cholera, and Sir Alexander Fleming had all gone viral. Now, again, interesting to think of what happened when everything did go viral in the pandemic. But I really thought this was a very poignant question to ask. And she recognized that there's a paucity of infection prevention and antimicrobial stewardship content. And that means, and I think we would all agree, right, that we in the healthcare industry must embrace and integrate social media into our framework. So again, for that person who was really negative in that evaluation, thinking I was a lunatic for talking about social media in the framework of antimicrobial stewardship, it's happening, whether we recognize it or not. Also, that infection prevention and antimicrobial stewardship research, treatments, and interventions are constantly evolving. Again, I think we would all agree on that, requiring faster dissemination and implementation. And to this point, you know, there's tons of podcasts out there. I'm not one of those podcast people that is constantly telling you about podcasts, but for IPs, this is a great example. Of course, I'm biased because Dr. Mohammed Faqih, who is a Michigan-based infectious disease doc and one of my mentors in infection prevention, he was a guest on the ASHI podcast. And this was a really cool discussion about deconstructing near-analysis and diagnostic stewardship. And it was something I could actually listen to as I was getting ready. And this is all along the idea of disseminating research faster, because we know that those large academic centers who regularly conduct research, they have an advantage over the smaller rural places who they don't have the time. Those IPs, none of us have the time to be reading journals and journals and journals. And so if we start using social media to learn about what's actually happening, we definitely can disseminate the research faster and adopt best practices. So to that point, I want to talk a little bit about visual abstracts. If you've never heard of this concept before, I'm going to define a visual abstract for you. This is a brief summary of the key findings of an article presented in graphical format for easy uptake. Again, we're IPs. We don't have a ton of time to sit there reading 20-page articles. So the visual abstract gives us a quick overview of the main study findings at a glance, and then we can decide if we actually want to click on that link and read the entire study if it's pertinent to our needs. Again, visual abstracts support greater dissemination. And just a tip here, if you ever have a chance to hear her, Dr. Heather Gill-Martin has presented on this topic. She does a whole 60-minute session on visual abstracts alone, and it's fantastic. This is an example of a visual abstract, and this is actually one of the more detailed visual abstracts. I'm going to show you a simpler one. But this is from Emory Internal Medicine Residency, and you know, again, this was perfect for us in the throes of the first few weeks and months of the COVID-19 pandemic. This gives you the information in a snap. It's the bottom line up front, or in sales, I think they call that bluff, right? Bottom line up front. You can get everything pertinent from this study by looking at this visual abstract without going through 20 pages or 18 pages or even 8 pages of heavy text to get through. So Ibrahim and team actually published a visual abstract on the success of visual abstracts. And so this is from 2017 in the Annals of Surgery. If you include a visual abstract with your article, it has the possibility to disseminate much greater numbers. So here we see that if an article related post had a visual abstract, it increased the impressions, again, that number of time it flashes on a screen for people, almost by 8-fold. If it had a visual abstract attached to that post, it increased retweets and also visits to the actual website that you click to read the whole study. So I think this is really interesting. All of this, again, saying that social media is a very important strategy for us to consider when we're talking about disseminating infection prevention and antimicrobial stewardship best practices. I actually think that we should all do visual abstracts and not have to write up those big publications, but maybe that'll come in like 2040, because that's really time consuming. So let's shift gears a little bit and talk about some of the public health influencers who not only flipped the script in 2020, but they also helped me do my job. So when we're talking about how social media helped me become a better IP, these are the people that I trusted and followed who helped keep me ahead of all of the chatter on the nursing units where I saw this on TikTok and I read this study. When we were in the throes of the COVID-19 pandemic, we didn't have time to read all these studies. And so I really appreciated these people who helped boil it down for me in very easily digestible ways. I'm not sponsored by any of these people, again, and you can definitely share with me your social media anchors that helped you through the COVID-19 pandemic, and I'm happy to add them in. These are just the voices that I resonated with most. And these three women really helped me. I hope I get to meet them one day. Jessica Malati Rivera, she is an ID epidemiologist, mother of 3 based in Los Angeles, and she was integral in the COVID-19 tracking project, if any of you used their data and statistics at the beginning of the pandemic. And her voice became amplified by celebrities like Kristen Bell and Dax Shepard, who are actually both from Michigan. And she really gained a ton of popularity by that amplification. She has, and I'm just to note here in the next few slides, I'm putting the number of followers here as kind of a reference point of how loud their voice is, and then what their primary platforms are here at the bottom. So of course, Instagram is this logo, and Twitter. I think you had the key at the very beginning too. So next is Dr. Kat, epidemiologist. She's really good at being on TikTok and debunking all of these bad videos that are coming out. And she's a bit spicy too. She teaches at the University of Chicago, Illinois. University of Illinois in Chicago. She's pretty cool. She listens to punk rock on roller skates. I like her style. And then I think many of you know Caitlin Jetelina, who's doctor of epidemiology as well. Subscribing to her newsletter for me is a must. She helped me combat so much disinformation throughout the COVID-19 pandemic. And she continues today with these newsletters, and she's discussing all areas of public health, gun violence, measles outbreaks, whatever the case may be. So I highly, highly recommend following her in one way, shape, or form. She is just really, her information is always reliable, non-biased, and an excellent source of information for all of us. Again, keeping in mind the fact that you're super busy and you don't have time to look at those journal articles that are being mailed to you at the office. And these people are really helping us boil it down. Next, Dr. Everywoman, she's actually, her real name is Dr. Wendy Goodall, and she's a board certified OBGYN medical influencer. She does really fun things on TikTok and Instagram, but it's humor based in teaching people about women's health. And throughout the pandemic, she actually was sharing really wonderful resources and studies specific to women of childbearing age and the COVID-19 vaccine. Next is Dr. Emily Smith, also goes by Friendly Neighborhood Epidemiologist. Not as many followers as some of the former folks I've talked about, but I bring her up because she has a very interesting perspective. And her tagline in her blog and her Facebook page is science and faith through the lens of equity and love thy neighbor. And so what I love about Emily is that she leverages her faith to communicate with the public, respectfully deconstructing public health myths commonly linked to religion. So whether that be women's health issues, vaccination, et cetera. And so it's reaching a really important group there. And she tries to meet them again where they're at instead of telling people they're wrong for their religious beliefs. She comes at it from a very understanding place. Next is Dr. Darian Sutton, definitely easy on the eyes. He's a board certified emergency medicine physician who hosts TikTok Med School. I love to listen to training scenarios and kind of, can you guess the disease scenarios as well. He's also a member of the LGBTQ community and uses his social media platform to educate the public and his fellow medical professionals. And you can see here, some of these doctors have a way higher following. So he's at 1.8 million followers today. He's also featured on Good Morning America, but I'm not up that early to ever watch that show. Another really useful blog throughout the pandemic was Dear Pandemic, and they've created this group called Those Nerdy Girls, and there's actually a Spanish option called Las Nerdy Girlas. And again, this is an interdisciplinary team of women. They post really helpful visuals that you can share again on Instagram or on your Facebook page, whatever the case may be. Their goal is to help the public navigate this, again, overwhelm of misinformation and disinformation. Next, ZDoggMD. If any of you know me, I've always kind of showed ZDoggMD videos. I don't follow him as closely anymore, to be quite honest, but it's really important to note him because he has a huge following, 2.5 million followers, and most of them are healthcare workers. So if there's something happening in healthcare that's relevant, he's usually discussing it on his YouTube channel or Facebook. He's a hospitalist by background, and he does use a lot of comedy and parody to address, again, issues that plague us in healthcare. So I think he's important to at least know he exists. Something interesting about him too is he actually interviews many people who are pretty controversial throughout the pandemic, people who had differing views than most of us on masking and vaccination and the vaccine series, for example. But I personally feel that just because someone doesn't agree with what I say or I believe doesn't mean I shouldn't listen to them. And so I do think that ZDog, or Zubin Damania, does a fairly good job at trying to present both sides of an argument. Lastly, Kizmekia Corbett, PhD. So Dr. Kizzy, she goes by on Instagram. She's actually one of the women who helped develop the Moderna COVID vaccine. And she has worked tirelessly, specifically with those vaccine hesitant groups, especially African Americans and people of color, by showing herself like, hey, I made this vaccine. I want to talk to you more about it and help build your trust with this, with the vaccine overall. So she's been very instrumental. So my last doc to follow, I'm going to try to play this video. We did trial it, so hopefully it'll still sound pretty good. This is Dr. Glaucom McFlecken, but his real name is Dr. Will Flannery. And so I'm going to play this video for you guys. Some of you may have seen it.
Hi, pharmacy. How's it going? Oh, hi, Dr. Bill. Your medication bottles look very nice and organized today. Thank you. Can I help you with something? Oh, well, I was hoping to order some antibiotics. Oh, of course. What would you like to order? Some meropenem? I'm sorry, I couldn't hear you. What was that? I'd like to order some meropenem, please. Meropenem. Yeah. One of the broadest spectrum antibiotics in existence. Have you lost your mind? What do you mean? Do you have culture and sensitivity data to back up this request? Well, it's pending. Have you consulted your antibiogram? I don't have one. Do you even know what you're treating? Yeah, it's a fever. Are you trying to make a superbacteria? Because this is how you make a superbacteria. No, of course not. Hey, Tom. Yeah, what's up? Dr. Bill wants to treat a fever with meropenem. Huh. Is he trying to create a superbacteria? No, I'm not, I swear. Then I suggest you order ceftriaxone and stop trying to destroy the human race. Pharmacy, I got bugs to kill. Infectious disease. What a pleasant surprise. What can I get you? Meropenem. Yes, of course. How much would you like? All of it. Yes, sir, right away. How come he gets meropenem? He, Dr. Bill, is an antibiotic steward. What's a steward? A steward is someone who's devoted their entire career to the responsible use of antibiotics. Well, I can be a steward. Really? Are you willing to go out of your way to shame every other doctor for using broad-spectrum antibiotics? Yeah. Are you willing to stop ordering Flagyl for anaerobic coverage? That's what I thought. Better luck next time, kid.
All right, now I have to stop that, or it'll keep playing. So I hope you enjoyed that. This actually went wild with all the ID pharmacists. Oops, I think someone might be off mute. So be careful in case you yell at somebody or swear, you're not muted. But Dr. Flannery is awesome. He's by day an ophthalmologist, and something interesting about him, again, 2.1 million followers. So look, you can just see how that message of antimicrobial stewardship with humor has been amplified across the globe. He's become very popular. He speaks at large conferences like the American College of Emergency Physicians. He was just in Australia. One other thing I don't know if you know about him, this drive to use humor to educate actually started when he experienced a sudden cardiac arrest, which some of you might know that my sister experienced last summer as well. And his wife performed CPR on him for 10 minutes, 10 minutes, 10, and saved his life. And after that, he decided that he was going to change and approach his career differently and use humor to educate the masses. And I just think that's super inspiring. Now I got to
hi, pharmacy. How's it going?
Get past this slide. Okay. So I mentioned all of these people across social media that have a huge public health influence and medical influencers, especially physicians that we see in the millions here, active across social media platforms. But very few, I would actually say none of them have CICs. There are CICs. And so compared to the aforementioned accounts, I just want to put it in a perspective. APIC has 14,000 followers. We compare that to these other accounts we're looking at. And it means that we're not really amplifying our message, our mission and vision. Public health influencers have not yet tackled HAIs, healthcare-associated infections, in a transformative manner. In fact, your local epidemiologist, in her newsletter, she actually sent a survey. She wanted to know of her hundreds of thousands of followers, who were they? And in the comment section, I said, you know, one of the options of topics that wasn't even listed on her multiple choice selection was HAIs. And I said, you know, that's one topic none of you have tackled, and I would love to partner with you and amplify the message of HAIs, because to date, we just don't really have that person. And if you know of that person and I don't know of that person, I am definitely here to take your recommendation. And I apologize if I've cut somebody out that really has amplified our message. But I want people to recognize that public health epidemiologists are obviously not the same as hospital-based infection preventionists or epidemiologists. We just have a different view. And I asked myself, again, it's just a question, a rhetorical question, is how can we really amplify our mission and vision if we continue to stay hidden in the background, where many of us feel very comfortable, right? I certainly did when I was a hospital-based IP. I didn't like to make a lot of noise. Now, the Infection Prevention Posse, this is a hashtag you can use to connect with people, primarily on Twitter. And I wanted to point out some of these folks, and a lot of familiar names, and many of you on the call, I think, are here. Intentionally, I wanted to surround myself with the Michigan-based IPs that I connect with on social media. Every one of these IPs has a different level of social media usage, but the point of the slide is just to show you this interconnectedness, that being active on social media gives me a sense of confidence in that I have people to turn to. Jill Holdsworth is Emory-based infection prevention manager, as an example. She is very vocal on social media, and she uses her platform to really educate and, again, amplify our message of infection prevention. For all of you here, I just want to say thank you for connecting with me. And there are many more IPs on social media. Again, I was just kind of going through my list of Twitter follows and followers and pulled them off of here. Now, you don't have to go individually and look for these people. You could actually go to my account and see who follows me or who I follow, and that could be a way of identifying these people as a tip. Shifting gears to networking opportunities, because I'm talking about networking, and so many of us feel alone in infection prevention and control, and we can even be in a team of 7 people and feel alone. And so I want to highlight that LinkedIn is really a really phenomenal avenue for networking. 900 million members worldwide, and you can look at this map to see where they all are dispersed. 40% of users access it daily. Interestingly, they don't spend more than a few minutes on it. So maybe they're looking for jobs or just seeing what's out there, but they're not spending hours and hours and hours on LinkedIn. I thought it was interesting that 44% of users make over 75K per year. And then in one of their own internal studies, job seekers with a comprehensive LinkedIn profile had a 71% higher chance of getting a job interview. And I think it's really important for any of you looking for, to further your career or looking for new career opportunities. Everybody, your employers, I can guarantee you, maybe I'm going through the interview process right now. We're hiring Jim Goche's replacement. So don't cry too hard, but that's the first thing I look at when I'm looking through resumes, is to go to your social media account and see what again, you've done there, what your presence is. Everybody's doing this. So employers are going to look you up. And if you're looking for that job, it's an idea. You don't want to leave them guessing. So for those of you who might be hiring, or you want to check people out, and you want to do it incognito or discreetly, I want to make sure you understand that if you don't pay for a premium account, other users can see that you've been looking at their profile. Now, don't freak out. It's not like it's high school and that people are going to ask you to go study or wear their letter jacket. This is the networking of today. Social media is professional networking. But if you want to do kind of a discrete investigation or research on somebody that you might be hiring for an open position, here's a tip for you, and similar on Android devices. I don't have an Android phone, so I apologize that this is, Apple friendly. But on your Chrome window in your phone, you click the three dots in the bottom right-hand corner, and you can open up a new incognito tab, and you can actually Google the person's name with LinkedIn, and you can look at their profile. Don't log into your account though, because it's going to prompt you to log in and you want to bypass that. But it is really important. A lot of us do want to have a sense of somebody that we're inviting into our team. It's very important. So you heard it from me. LinkedIn is also a way for us to professionally amplify our messaging. And, oops, sorry, now of course the mail is going to come. I'm going to mute myself for just a second. Hopefully it's not too bad. So this never happens except when I'm presenting. Social media sites like LinkedIn can amplify our IP platform and help you build your brand. Wanting to build your brand as an IP is not a bad thing. So I want to show you how you can kind of follow different hashtags. So the example I gave here is vaccination. And so you can use the search bar to enter the term you want to follow. I didn't use infection prevention because I've already was following that hashtag. And then you click the follow button, and then you'll get notified of any of those posts that have that hashtag in them. And this might seem basic to some of you, but I really want people to understand that using these different techniques help amplify that message and spread the word if that's what you want to do with your career or with your research. So using and following hashtags makes your posts more visible to your peers. Here's an example of one of my posts, and whether you're a premium account user or not, you can do your own post analytics. That's what I show here in this box. I'm sharing that I posted an infection prevention risk assessment video on YouTube. I learned that using hashtag YouTube is probably not a great idea because all of those folks who follow hashtag YouTube and they want to help influencers out, spread their message, that wasn't my intention. But what you can see in the post analytics is that by using infection prevention as a hashtag and risk assessment, you can see who I've reached here, the top demographics of my unique viewers. And of course, not surprisingly, 115 infection preventionists this reached, 48 infection control practitioners, so on and so forth. All of us can do this without paying anything into LinkedIn. Now, in researching this presentation, I was interested to see that you could actually look in LinkedIn you could look at how many followers each hashtag has. And so again, we can use these types of techniques to amplify or keep our messages quiet if we don't want people, if we don't want it widespread, that's okay. But you can see the difference here in hashtag EVS having 6.4 thousand followers. But if I actually spell out the word environmental services, I've actually over doubled my followers. And this would be almost 16,000 followers. So if I'm posting something on LinkedIn and I want to get a wider audience, I would want to do hashtag environmental services over EVS. Now, if I really want to amplify a message, and turn the volume all the way up, you can see here 9.7 million followers on hashtag healthcare. I don't tend to use this healthcare hashtag, but this has definitely given me a lot to think about in strategically posting a message and understanding where my message is going. Using hashtag public health, for example, I'm going to be reaching 700,000 followers potentially, and I might see those impressions of the post go way up. Of course, there are social media pitfalls, and anybody talking about social media and healthcare is responsible for sharing these pitfalls. There are, again, not surprising to most of us if you're on social media, an exceeding number of healthcare providers who are revealing what life is like on the other side of the curtain. And a lot of major organizations have resources and policies and procedures to identify and stop inappropriate content. But what's really scary is that there are many more that don't have the resources and have no idea what their healthcare workers are posting online. And so I'm going to show you this example. I'm going to turn the volume down because it's really loud. I'll probably make Mumford start barking again. What I did, just to share how I found this, and I don't like to promote bad content, but I searched to TikTok for nursing home ICs based on a story in the New York Post late last year. A group of nurses, despite the humongous nursing shortage that we're all facing, a group of nurses were fired because they posted their labor and delivery ICs. And ICs means that they were posting videos of the things their patients did to gross them out. And so let's see, I searched TikTok for nursing home ICs. Okay, now for all my IPs out there, how frustrating and infuriating is that post? So not only did you know about this because you didn't clean it the first time you identified it, somebody put a bedpan in a handrail. There's obviously, she thinks it's bedpan mold. I think that's to be debated on what that actually is, but you continue to post it. You disparage your healthcare facility by putting this online for the public to see. And did you even clean it? And then I forget, did she have a glove on her hand? Guess I should watch that again. Okay, well, thank God for that. But I think you guys get the point. And I want to make sure that it's very clear that any posts that shame or disparage fellow healthcare providers, patients, facilities, or the communities we serve are unacceptable and should be reported immediately. Now I got to get past this TikTok thing. There's a little funky key thing that I have to do to get past the videos. So this is a great resource for everybody. If you're looking at those 10 simple do's and don'ts, this is provided by the Nursing Services Organization online. I'm not going to go through each 10 of these points in the interest of time, but we always, always, always have to maintain patient and fellow employee privacy and confidentiality. It's just really fascinating to see how many people don't truly understand what that means, because some of the content out there that's gaining the most attention is horrifically disparaging to institutions. I want to talk a little bit about how social media helps save lives during the pandemic. I know a lot of us don't like to think of this, and it's really hard to look back to these dark days. But the reality is that there was idea sharing on social media that actually turned into life-saving techniques. Now, I know some of you on the phone dealing with bloodstream infection increases throughout the pandemic are cringing at the picture that we saw on social media of IV poles and pumps outside of the door, and tens of 20s of feet of tubing, of course, increase the risk of bloodstream infection. But I remind you, and I don't think I have to remind many of you, that we were in a terrible, desperate time and we had run out of PPE. We had run out. And this was a very innovative way shared on social media of a way to help at least control meds without going into the room with PPE. Another story I like to highlight is a former colleague of mine, Dr. Charlene Irvin, who I think is still an Ascension St. John emergency room physician. And she shared a video on YouTube of how to convert one ventilator to save 4 different lives by expanding the tubing. Now, she acknowledges at the end of the video that this is a desperate measure only, a field medicine technique, potential infection prevention issues. However, again, we were at a point where we had ethics committees engaged to decide who was going to live or die. And this was a video that had over 1 million views. I thought that was pretty fascinating. I also use social media to help other IPs. So how does social media help me help other IPs? I've started a YouTube channel. This has gotten quite a bit of attention from National APIC, and I'm getting really good feedback from individual IPs. Pat Jackson, who's the current president of APIC, in a March APIC strategic partner call, I don't know what the data source was. She didn't list it. I think it might have been one of our mega surveys, but she says that 37% of APIC members are the only IP in their department. Many of these are part of a larger system, but again, that doesn't mean that they still don't feel very alone. 16% of those surveyed truly had no other IP support, and that's some of the people that I've been mentoring that are truly by themselves in rural facilities. And I'd like to remind you of survey bias. So when APIC does a mega survey, it only reaches APIC members. So those IPs whose leadership or administrative teams don't pay for their membership, we're really not getting their voices captured, and I think that's important. Very overwhelming overwhelmingly positive feedback from this annual risk assessment video. If you heard, I was on the 5-Second Rule podcast. I couldn't believe, I mean, I was brought to tears how many IPs reached out and said, oh my God, thank you for doing this. Nobody ever explained this to me. And for my former colleagues who can't believe I actually recorded, a video on risk assessments, which I hated doing, I totally apologize, but actually having some distance from these things is a good thing. And I was able to help other people. Another resource on YouTube that I want to point out, especially for those of you in long-term care, is Dr. Buffy Lloyd Kreschke. She is well-versed in long-term care infection prevention. You might know of her and you might not dig everything that she says, but I do think that she does a really good job with her instruction and educational videos. There's APIC chapters on Instagram. Here's just a few. Again, you'll get your slides. Contact info is here. Obviously, I'm on many different platforms of social media. I know we only have a few minutes. I do that intentionally because I tend to not get a ton of questions. I just want you guys to know and be introduced to Ed Bennett. Ed is your new healthcare sales rep from Diversey. And I want you guys to know that Chuck is okay. He was promoted. Everybody's been really nervous not hearing from Chuck. So just letting you know that Chuck is fine and he's still in Michigan and he's still around as well. So with that, I'm going to stop and look at the chat. Kelsey, Chow, I don't know if you guys, and Denise.
Yes, thank you so much, Rebecca. Your presentation was amazing. I learned a lot, and I'm sure I'm seeing some thank you for the presentations. Lots of kudos and a great presentation. So far, no questions yet, though.
Okay, great.
I have pinged a few times asking for some questions.
Oh, good. And I see Amy says that they're doing a LinkedIn makeover at National APIC this year. Ooh, I love that. Thank you, Amy. You can get a little makeover.
Yes.
Okay.
We have our first question. Rebecca, can you address the risks of posting versus employer concerns regarding your opinion?
Yes, I think I kind of glazed over this, but I'll go back to the slide because I think this is a really good one when we look at those pitfalls. And again, from the Nursing Services Organization, they do say that, again, it is completely appropriate to use social media to post positive comments about your workplace and staff. You're never going to get in trouble for saying, I work in the best place ever. And if you're using social media to post educationally in a positive way, I think that would be supported as well. But I do think that it's an excellent question and that everybody needs to be reminded to look at your social media policy at your facility. Keeping in mind, if you work at a smaller facility, you might not have a social media policy, but I would say the majority of healthcare organizations do. And so we want to be very cognizant of what your social media policies are. There's a nurse on Instagram, that nurse, Erica. She does a lot of education, making sure nurses and other clinicians understand that if you post while you're at work, that could definitely be something that could get you into trouble, whether it's good or bad. So you want to, again, make sure you fully understand your organization's social media policy. I think I'm side-eyeing the chat box too, Denise.
More kudos. And Karen is giving a shout out to our friends at APIC Ohio Northwest chapter. So we're so glad that we were able to have some of them join us as well. So that's exciting.
And I think I'm going to see them very soon on May 24th at their spring conference. So if you like hearing me talk, you can hear me more. We're going to talk about that risk assessment presentation. I think I have to look back. I'm getting a little confused, but yes, welcome to the Northwest chapter. It's awesome to see you guys reaching out and collaborating with others.
Okay. As Chow brings up our final slides, I'm going to keep an eye on the chat box as well for any questions. But before we leave, we do want to make sure that we give you some quick APIC Great Lake updates. Please remember that the event flyer is posted in the APIC Great Lakes webpage with all of our 2023 events. Our next session will be Tuesday, July 25th at 1 p.m. with a presentation on renewing your certification in infection control with the Certification Board of Infection Control and Epidemiology. And so we not only have a speaker from CBIC, but we also have some of our fellow APIC Great Lake members sharing their renewal experiences. So please save on your calendar to join us for that. As Chow mentioned earlier, we will send out a post-webinar email with a link to our YouTube channel where all of the session recordings, including today's sessions, are posted, as well as a link to where Rebecca's slides can be found on our APIC Great Lakes webpage. And when you're on our YouTube channel, don't forget to hit that subscribe button. If you have any job openings, please send them our way and we'll be happy to post them to the webpage to help your team with recruitment. And finally, Rebecca, on behalf of the APIC Great Lakes presentation, or APIC's Great Lakes Education Committee, we want to thank you for your time today, sharing your knowledge and educating us on how social media makes us a better IP. I definitely see places that I can become much more engaged, and I'm excited to do that in the future. So thank you, Rebecca.
Thank you, everyone. Thank you so much. And Lisa reminded you to join the APIC Great Lakes Facebook page. I was just looking through, so do that too. And good to see all of you. And thank you so much for this opportunity.
Thank you, Rebecca.
Thanks. Sorry about
Thank you, everyone, for joining.